How did you started your profession as a doctor, sir?
What is the purpose of a car? I was more motivated towards actually Pondicherry. In total, if you take, there are almost 11 medical colleges. There are so many standalone hospitals. There are many tertiary care hospitals. But still, there is a
Hi, hello everyone. A warm welcome to our new YouTube podcast series Leaders Speak, where we explore the journey of entrepreneurs and innovators who are shaping the future. I'm your host Samrita, pursuing MBA at Takshashila University. In this podcast, we will talking to the successful entrepreneurs who have turned their passion into a booming businesses. With great joy, I would like to welcome our esteemed guest, Dr. Arulmani Sir, Senior Consultant Critical Care Physician, the inspiring director and founder of WestMed Hospital, Puducherry. It's my great pleasure to welcome you, sir.
Thank
How
you.
did you started your profession as a doctor, sir?
So from my childhood, it was my dream to become a doctor.
Okay, sir.
So I took a biology group in my schooling with a vision to become a doctor. So I took a biology group and I joined MBBS. So my passion was to serve the people, to give a quality healthcare, so which is affordable to all. So that was my vision when I was taking up the graduation itself. So which I took over, and today I have an hospital to fulfill that dream.
So nice of you, sir. What inspired you to transition from being a doctor to being a entrepreneurship, sir?
So after my graduation, I was doing my general practice.
Okay.
So I was having my own clinic. Per day, I used to treat around some 50 to 70 patients per day in my own clinic. So that I was having a very good practice. I was having a good reputation from the patients. So as time goes on, I was more motivated towards healthcare administration. So
Okay,
rather than doing a single doctor practice,
Okay, sir.
it motivated me to go towards healthcare administration.
Okay, sir.
So I had a dream of starting an hospital. So I joined in Bevel Group of Hospitals as a medical director
Okay, sir.
to work and learn healthcare administration. So I was there as a medical director for almost 5 years. I learned healthcare administration, how to handle healthcare as a business, how to handle healthcare in administration. Everything I learned from there. Then it took me almost 5 to 6 years to come out and start my own journey.
Choose this locality, sir.
Okay. Actually, Pondicherry, in total, if you take, there are almost 11 medical colleges. There are so many standalone hospitals. There are many tertiary care hospitals.
Okay,
But still, there is a lacuna or need for the healthcare to be filled in Pondicherry. So there is a big myth in Pondicherry that any treatment they need, they travel to Chennai.
Yes.
So people used to travel to Chennai for their treatment, for which their logistically it takes a lot for them. Like they have to travel from Pondicherry to Chennai, and transportation and cost of treatment in the metro city is expensive. So it is like people have their own wish, like going to Chennai may benefit them, but giving a similar healthcare in Pondicherry, that will give good price point treatment to them, that for what they spend they get the best treatment. And I believe, like, for every treatment what you need, you should know the sector where you want to go. Like for example, for a small treatment, for a small hernia surgery, or for a small hydrocele surgery, or for a small sebaceous cyst, a secondary care hospital will do the best in that, for that treatment. Going to a tertiary care hospital for such treatments, that may add up the cost for the treatment, and that may overburden the patient on spending for the treatment. So it is like tertiary hospitals will provide such treatments.
What is tertiary hospital, sir?
So usually we categorize hospital sector into primary, secondary, and tertiary.
Okay.
So primary care hospitals, usually you see this primary health centers, clinics, small clinics.
Okay. Okay.
So where you get OPD services, where you get basic healthcare needs,
Okay.
and what a basic facility to be provided in a healthcare will be provided in a primary center.
Okay, sir.
So in a primary healthcare, disease prevention, identifying diseases.
Okay.
Government has so many missions for doing primary healthcare services. In that, private sector also plays like small clinics where they identify diseases at the early stages. So these level of treatments comes under primary.
Okay.
But secondary comes as next level of care, like inpatient services, like basic ICU services, basic operation theatre services,
Okay.
basic casualty services. It comes to the next level.
Okay, sir.
So mid-segment hospitals comes under secondary care hospitals,
Okay.
where they provide ICU care, operation, they do emergency and casualty services.
Okay, sir.
So these things will be provided in a neighborhood facility itself.
Okay.
For example, not more than 5 km. Like if my residence is 5 km away, I can reach to this hospital within 5 km.
Okay, sir.
So if a tertiary hospital is available at some 100 km away or some 50 km away, it takes you almost 1 hour, 1.5 hours to travel to get a basic treatment to be done.
Okay, sir.
So the treatment cost and your time, everything can
yes.
be minimized in a secondary care hospital.
Okay,
So
sir.
secondary care hospital provides varied treatment, and India needs secondary care. So since a varied population with different cities and the different 2-tier and 3-tier cities, establishing a tertiary hospital in these locations will be very difficult. So keeping a tertiary hospital in every location may not be possible.
Okay, sir.
So secondary care hospitals will fulfill that need, so that any tertiary needs can be minimized. Like for example, if 100 patients going to tertiary hospital, the 50 to 70 can be minimized at the secondary level.
Secondary.
So 30% can go to a tertiary level.
Tertiary level.
So because most of the patients who need that secondary level treatment are the maximum.
Okay, okay, sir.
So like tertiary level treatments, like going for an open heart surgery, going for a transplant surgery,
Okay, sir.
these things comes under tertiary care.
Okay,
So
sir.
tertiary care hospitals are equipped for doing advanced procedures.
Okay, sir.
So for doing a small hernia surgery, why should I go for a center
Yes,
which is doing a transplant?
Okay, sir.
So it is like a small procedure,
Okay.
but I am spending
Too
at a
much
higher
of-
cost
Okay, sir.
for doing the procedure in a tertiary care.
Tertiary care.
We cannot question why tertiary care is charging on a higher side. We
Oh.
cannot question that,
Okay, sir.
because it is their expense which they are meeting out. So that has to be paid there. So, but secondary care operates at a very nominal charges. Secondary care hospitals, since their operating cost always will be on a lower side,
Okay, sir.
so the cost of treatment to the patient also benefits them.
Okay.
And also the neighborhood facility,
Okay,
like
sir.
available within a close range, gives them a benefit of being in home. Like if patient is admitted in hospital, the family can come and see them within some 5 km
Yes.
circle. Patient anytime they can enter the hospital for their review.
Yes,
So in this way, secondary care hospitals plays a vital role.
Thank you for
So-
your brief explanation, sir. Sir, how do you balance the ethics of medicine and realities of running a business, sir?
Very good question. So I consider it like you are buying a car.
Okay, sir.
Okay, you are buying a car. What is the purpose of a car?
Sir,
Going from place A to
to
place B.
destination.
Correct.
Okay.
Like I start from one place
Okay, sir.
and I end in one place.
Okay, sir.
Okay. So that is the purpose.
Okay, sir.
That is the purpose of buying a car. In between, what is needed for you from A to B, if you are going in a car, what you need?
Petrol,
You need a fuel.
fuel. Okay, sir.
Correct.
Petrol or
You need-
diesel?
You need a fuel.
Yes, sir.
There is a purpose. There is a necessity
Okay, sir.
to go to the place. There is a necessity. You want to reach a destination. For that, you need a car.
Yes,
To
sir.
run a car, you need a fuel.
Yes, sir.
Similarly, as a hospital owner, as a business owner, I have a vision. I
Okay,
have a
sir.
vision to reach world-class healthcare to
Okay,
all
sir.
the sects of the society.
Okay, okay, sir.
Okay, so that is my vision. So I want to reach to that level.
Okay,
To
sir.
reach to that level, we need a fuel.
Okay, sir.
Correct.
Yes, sir.
To reach to that level, nothing comes free of cost.
Yes, sir.
So everything needs a fuel to run the business.
Yes.
Correct. So the entire community, entire business depends on the community.
Okay.
whatever you do, whatever business you take, the business is for the people.
Okay, sir.
If there is no people, if there is no society, where your business will stand?
Yes, sir.
So any purpose of business is to serve the people.
Okay,
So whatever business you take, food industry, aviation industry, whatever you take, if you are going to solve the solution, if you are going to give a solution for that society, then that is a business model.
Okay, sir.
Okay, so I have a vision. I want to go to a destination to
Okay,
reach
sir.
world-class healthcare to all. So that is my vision. So for that, I need a fuel to reach the destination.
Okay.
In such a way, if I think to run this business, we need some financial to be met. Financial needs to be met.
Okay.
So for what we are doing, for what business we are doing, with that expenses to be recorded from the
Okay, sir.
patients whom we take.
Okay, sir.
So if it is actually, it is a very thin line, like giving service as a healthcare provider and charging for it. It is a very thin line.
Okay,
So you
sir.
should not do overcharging.
Yes, sir.
Similarly, you should not do undercharging, which may hinder your business.
Yes, sir.
So you want to reach the destination. Like if you take it like full charity, if you take, if you're not charging up to the expenses what you are not making,
yes, sir,
then automatically your business will collapse.
Okay,
so in order to sustain the business, it should be considered as a profit making business. Similarly, to whom we are going to cater the service, that also should not be avoided. So we should give the service to the society. Similarly, to run the business, we need the financial needs.
Okay.
So business and healthcare providing are just demarcated by a very small line. So we have to take both under consideration, and both has to be taken balanced.